I'm grateful to the Mubahith organization for arranging this webinar. And I'm grateful to the Dr. Umar bin Abdul Aziz for sending me an invitation to deliver this talk. Dr. Umar, if you can make me host, co-host, so that I can share my slides. So we have, right now, we have participants, they are joining. So I warmly welcome you in this session. Let me share my screen.
I think you can share your screen now. I have made
Yeah,
you host.
yes. Now, yes. Now, can you share? Can you see my screen? So there is a QR code. If you can, is it
Yes, I can
visible?
see your screen now.
So yeah. So the first slide is about the QR code.
Okay.
Yeah. So now I have to admit the
Now
participants,
you're
right?
host. That's why I was,
So
you know,
if you have made co-host, okay, let me make you co-host so that uh,
I think you can share your screen without being a host also.
okay, okay, fine.
For that, you have to make me
So,
host first.
yeah, yeah, okay. So I warmly welcome you to the all of you in this session. So I request you to please scan this QR code because it's going to be an interactive session and your active participation will make this an engaging experience. If you can scan it from your smartphone, otherwise you can also go to the Curie.live and enter this pin. So we are waiting for the participant to join us. Yeah. Okay, fast doctor, friendly smile, right? So let me admit all of them. So if we can more participant, we have more participant, but I believe the people they are joining, and yes, I'm admitting them. Yeah.
It's a good name, Jumping Bear.
Yeah, yeah. Jumping. So are you co-host or not? Because I have to manage the participant who are in the waiting room as well. Kind pizza, right? Skipping Robert. So at least we have now 6 participants. They have joined this Curie. Okay, walking
More than
volcano.
that, I can
Okay,
see more than 14 participants in the chat box,
yeah,
in the participant
but
list, but
yeah, there's
in
16.
Curie we
Yeah,
have 8.
yeah. So
By the
it
way,
means
I'm
that
jumping Android.
can you admit them or not?
They are all
Because
admitted here.
okay, so maybe okay, fine. No, I'm going to start off, right? So we have a sufficient number of participants. Bismillahirrahmanirrahim. So so before we get started, so let me declare that I don't have any affiliation with any of the AI companies related to this presentation. This is purely for learning and sharing your knowledge and experiences, and we are here to learn from each other. So over the next, so the because this is an interactive session, So I would request you to actively participate in the activities, because you will have the different activities. There will be, it will be open, quizzes and the discussions as well. So I would request you to keep your devices on silent and keep yourself muted unless speaking. And let's make it an engaging experience for all of us. So please let us know about your specialty and post-graduation experience so that I can tailor my session according to your needs. So here we go. Okay, medical education, right. So in your opinion, why is it important for the clinicians to learn about AI? What do you think? There's a chat box, there is an issue. Medical
People who
specialists.
cannot use Query Live who are new to it, they can
They
also
can,
use the chat box.
they can, yeah, if otherwise you can go to the browser and go to the query.live and enter this pin. And I request you to use preferably use a laptop or the desktop for this Zoom meeting. And in order to participate in the Curie quiz, so use your smartphone. So it's important for in rapid access to the information, right? Okay. So over the next 1 hour, I'm going to provide you an overview of key applications of the artificial intelligence in healthcare, particularly in the diagnostics, and AI-driven predictive analytics in the healthcare, its role in clinical research and medical education, and what are the challenges and ethical concerns in implementing the AI in healthcare. And we will close the session with a question answer session. And this is a vast topic involving the multiple specialties. So through these sessions, we will be having a diverse diverse group of the people from different specialties. So it will give us an opportunity from so that we can learn from each other experiences. So we live in a time where the artificial intelligence is, it's reshaping every aspect of our life. So from the social media to the finance, retail, it's powering the autonomous vehicles, the educations, and for us as a healthcare provider, it is also improving the diagnosis, patient care, and it is not a future idea. It is already here. Just recently, Stanford's AI Index report, which was published in 2025, reported that the AI, the FDA-approved medical devices, they were just 6 in 2015, and they jumped to 223 in 2023. Similarly, the number of clinical trials using AI, they are increasing rapidly over the couple of years. So it is not, it's not about the future. It's the reality, and it is the most transformative technology of the 21st century. It is developing at a tremendous pace. Now the real question is, are we are we ready to go alongside it? And in order to ensure that we do, we must understand what is the AI, how it works, how can we use it safely and effectively in our clinical practice, and most importantly, we ready? Do we have adequate knowledge and the skills so that we can collaborate with the AI developers, so that we can design the AI model, which is actually, they are fulfilling the real world needs. They are fulfilling the patient's need according to the end users requirements. 。 。 。 。 。 。 。 。 。 . 。 。 . 。 . 。 . 。 . 。 。 . 。 . 。 。 . 。 。 . 。 。 。 . 。 。 . 。 。 。 。 。 。 。 。 。 。 。 。 。 。 .
Uh,
So let's begin with some basics of the basics terminologies related to the artificial intelligence. So let's talk about what is artificial intelligence. So in simple words, it is the simulation of the human intelligence by the machines. These are the intelligent machines which have the ability to plan, predict, reason, classify, learn from the data, and they make decisions and adapt over the period of time. And then the machine learning. Machine learning is again a subtype of the AI, which uses the statistical tools, algorithms to analyze the data. They actually detect the pattern within the data, which are actually invisible to the human eye. And then they make prediction. And over the period of time, as you give more data, as you give them more data of these models, they improve their prediction. And taking a step further, so deep learning. Deep learning is inspired by the human brain. The neurological neurons are. So this uses the uh, neural network to solve the complex problems like image recognition, audio and video classification, and then it makes prediction with high accuracy. So let me give you an example. How does it work? Just imagine showing a picture of birds to this model. This is the artificial neural network comprising of different layers. So each layer actually comprises of the artificial neurons. So these circles, they represent the artificial neuron. So once you show an image to this model, so this image, the data will process through the different layers. For example, it will analyze what is the shape, its color, and as the data it moves along these layers, so it makes a prediction. So it will give us a result based on the probability. What is the probability of, is it a bird? For example, if there is an 80% the probability, yes, it's a bird. This probability improves as the data process along these layers. So each layer acts as a checkpoint, refining the prediction. And the more you give them the data to these models, their prediction improves over the period of time. So the around 800,000 Americans, they die are permanently disabled each year because of the diagnostic errors. So now the question is, can you provide a real world example where the AI could help reduce diagnostic errors or speed up the diagnosis? Also visualizing the general surgery consultant, yes, through the physiotherapy lecturer, general physician, research purpose, to incorporate new technology. Okay, the people there are also sending the message through the chat as well. Yeah, you right. That's great. So let's see what are the examples. So yes, analyzing the radiology images. For radiology images, only one. Okay, that's great. Let me see. Oh, is there any response in the chat box as well? To read psychophysiological, yeah, MRI and CT scan. Right. Yes, you are right. So let me give you the few real world application of the AI in reducing the diagnostic. Yes, you are right. Yeah, the 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 artificial intelligence has revolutionized the radiology. It, uh, it is improving the diagnostic accuracy. and it is being routinely used to interpret the mammogram, screening mammogram. As you know, the carcinoma of breast is the most common breast cancer, and these the AI with they can interpret at a very fast pace, and they reduce. They have been shown. They have demonstrated to reduce their false positive and false negative results. Uh, and this AI system, they have outperformed the human radiologists as well. So it's giving you uh, the diagnosis in a quick way, and they are very accurate as well. And they are reducing their workload on the radiology, especially for the negative reports. And they actually flag the mammogram which have some abnormality, so that the radiologists, they can review these mammograms. Similarly, the artificial intelligence can detect the lung nodules, the masses. Even they can diagnose the pneumonia as well. So the AI is being routinely used in the radiology. So it's also being used in the diagnostic, lab diagnostics. For example, there's the area of histopathology. So the digital pathology, AI with the digital pathology actually has transformed the workflow in the laboratory. It actually enhances the diagnostic workflow, and it improves the accuracy as well. So even in challenging cases like prostate biopsies, sentinel lymph node biopsy in the breast cancer, these can be picked up even without using the additional immunohistochemical stains. So the different platforms like AI Site from Path AI, the Visho, these are different platforms which actually providing this. They are enabling the digital pathology and allowing the pathologist to report the diagnosis in a confident way and more quick way. In microbiology, so with mildly tough mass spectrometry, we can detect the deadly bacteria from the blood cultures uh, within minutes. But you know, the antibiotic susceptibility, their reports, they are delayed for 24 to 48 hours. But with the help of the AI, so we can predict the antibiotic susceptibility and the resistance within 1 hour. So this is very crucial. This is very important. For example, if you're facing with life-threatening condition like sepsis, in which we have to find out what is the main pathogen which is causing this infection, so that we can prescribe the right treatment. So it can um, improve the survival of the patient. So there's another area, one of the most common hospital-acquired infections, surgical site infections. So the apps like My Health Pal, Red Scar, they can detect this surgical site infection. Most of the time, these patients, they have already been discharged, and they are at home and they are away from the surgeons. So it's difficult to monitor these patients. So with these apps, now the surgeon, they can monitor their patient while the patient at home. Once there is, they will take the photograph of the wound. If there is an evidence of a surgical site infection, this the patient will be alerted, and at the same time the alert will be sent to the healthcare provider, the surgeon as well. So, and it also recommends the steps to be taken. Similarly, the AI can analyze the medical notes, and it can detect the surgical site infection if the AI is actually integrated into the electronic health record. Similarly, in the endoscopy, so the AI being used to detect the precancerous lesions, the polyps, with the high accuracy and speed. In cardiology, so if the electronic medical record, they are integrated with the AI, now they can analyze, analyze and interpret the ECG and echocardiogram and the vital signs in a real time. Once the patient's in emergency department, so they can analyze it, and they have been shown to reduce the diagnostic errors up to 40%. So this is very important in the cardiology. Once we have a patient, for example, with a myocardial infarction, where every second counts. So these AI-powered EMR in cardiology, they have been shown to reduce the diagnostic errors. Similarly, smartphones, can be used to detect the skin cancers like melanoma, basal cell carcinoma. In ophthalmology, the retinal images, they have been being used with the help of the AI to detect the different eye conditions like retinopathy, macular degeneration. So the fundus photography, anterior segment photography, they are being used with the help of the AI. So far, we have covered the AI and the diagnostics. This was just an overview of the AI in diagnostics. So let's move to the next section, which is one of the most exciting use of AI in healthcare, AI-driven predictive analytics in healthcare. So in your own words, how would you define predictive analytics in healthcare? Here we go. So meanwhile, let me check. Histopathology slides for interpretation, right? Robotics, trauma patient, yeah. Okay, it's a trauma patient, right? So predictive analytics makes smart decisions. Okay, good. 70% to justify hypothetical. Okay, let me see. Is there any other response in the chat as well about the predictive analytics? Yeah, excellent, excellent. Who is Muhammad Umar Naseem? Yeah, he has responded assessing the current trends to predict the future outcome. Excellent to help in future decision making. That's wonderful. He has some of the predictive analytics in healthcare. Okay, then the average cost to calculate. Okay, good. This is all the other way of the application of the predictive analytics. Okay. Uh, So the predictive analytics, let me let briefly explain what is it. So there are different types of the data analytics. Data analysis, that descriptive, diagnostic, predictive, and prescriptive. So as you know, this predictive analytic, what they do, they actually analyze the current patient data and the historical data, and then based upon them, they make a prediction about the future. So these models, they have been trained on vast amount of the data. So they actually compare it with them, and they actually, they analyze the hidden patterns in the data, and then make predictions about the future. These are actually the probability this is going to happen in the future or not. And how does it work? Actually, so these AI model, they are analyzing, they are receiving the data from the different sources. So these data includes patient data like its patient's age, his sleep pattern, his socioeconomic status, physical activity, genetics, its health status. So the AI model, they are collecting the data. And how are they collecting? They are collecting actually from different sources like the wearable devices, smartwatches, the smartphones, sensors, the environmental sensors, the body sensor, which are actually monitoring the patient's vital signs like pulse, blood pressure, saturation. So everything is being recorded. And once they are collecting, because these devices, they are connected with each other through the internet. We call them as a internet of medical things. And once these data, they have been collected, it's a vast amount of the data. So these models, they analyze this data because they have the machine learning algorithms. So they will actually compare this data with the historical data, with the previous the training data as well. Then they make a prediction. Yes, this patient is at risk of developing, for example, malignancy. This patient is at risk of developing Alzheimer's disease, and then they make personalized recommendation. So it shifts the focus from the reactive treatment. That is, we are just waiting for the symptoms to appear, and then we treat them. Now it is shifting to the proactive and preventive medicine. So we are, this is one of the most transformative, the use of the AI in healthcare. So here again, a short questions in your specialty, because we have people from different specialties. Where do you think the predictive analytics could make the biggest impact in the patient care? Okay, so the diagnostics, okay, early diagnosis, right, operatives, okay, you select the best interventions, embryology, excellent, excellent. And one more, there was in the chat box, someone has mentioned about the, yeah, post-operative care. Yes, with the help of this predictive analytics, you can predict the patient's outcome. You can predict the complication of surgery complication. The patient is at risk of developing some complication for the bleeding, hematoma, anastomotic leakage, right? And there is one more, management of seriously injured patient. Yes, yeah, these predictive analytics, they have the application, the pre-hospital care as well. So we can monitor the patient in the battlefield as well through these predictive analytics. So diagnosis, yeah, early diagnosis, cancer management, yes, so the personalized recommendation we can give to the patient for the oncology patient, right? Early diagnosis for the cancer patient. Predictive analytics can make the biggest impact in the early disease detection. Wonderful. Personalized treatment, planning, reducing emergency visit. Excellent, Ara Jean. Excellent, excellent. Okay, so let's move on. So there are other participants which are actually saying they are unable to join the meeting. So, okay. So here I'm going to give you the few examples of the use of AI-driven predictive analytics in healthcare. So it helps in the early diagnosis, as you have mentioned that it helps in early diagnosis and intervention. And let me give you an example. Sepsis, as you know, it is a life-threatening conditions, and more than a third of all the hospital deaths, they are because of the sepsis in US. And can the AI change this landscape and help in reducing this mortality? So AI can actually predict the development of the sepsis 12 to 24 hours before the clinical recognition. And most of the time, we suspect the sepsis once the patients have already developed the signs and symptoms. That means the battle has already begun. So these AI model like FDA approved model, the sepsis immunoscore, EPIC, B alert, they actually flag the patients. Yes, this patient at risk of developing the sepsis well before 12 to 24 hours, before actual clinical recognitions. So that will give you a window of opportunity in which you can intervene and you can save the life of the patient. Because here It's every hour counts, because if the sepsis left untreated, patient will die within 12 hours. At Ochsner Health, the dedicated nurses, they have monitored these patients. For example, there's a control room, they are monitoring these patients. So whenever they get an alert, yes, this patient is at, the score is very high, patient is at risk of sepsis. So they will go through the electronic health record, and they, if there's a genuine alert, so they will notify the bedside team. So that will help to take action in a timely fashion. That this intervention has resulted into the 50% reduction in the sepsis mortality. Now, moving from the acute conditions to the chronic conditions. So these predictive analytics, they help in managing the chronic diseases, predicting and managing. So we can predict the development of the, for example, patients at risk of the breast cancer development, cardiovascular disease, diabetes, obesity before the onset of any symptoms, so that we can take a preventive measures. For example, say the breast cancer, with the help of the AI, through the screening mammogram, and once the AI is also integrated into the electronic health records, so these we can detect, yes, this patient is at risk of development of the breast cancer before the development of any signs, like before the development of any breast lump. Similarly, to the retinal scans, the chronic conditions like Alzheimer's disease, Parkinsonism, they can be predicted. Cardiovascular risk of cardiovascular diseases, hypertensions. So there are many more chronic conditions they can be predicted. So these predictive analytics, because once they help in managing the patients, like diabetic patients, with the chronic kidney disease. These are the chronic conditions. Yeah, these chronic conditions, they are actually comprising the 70% of the all the healthcare related spending. So these cancers, cardiovascular disease, diabetes, obesity, CKD. So it's very important to manage them, and it's also challenging as well. So how it helps? For example, the patient is at home, we can monitor their vital signs in a real time. So we collect the data to the different devices. So this data will, once it's integrated into the electronic health record, the patient is actually, patient with the diabetes, it's at home. Now, the healthcare provider, while sitting in their hospital, in their office, they will get alerts that this patient's blood sugar is very high. This patient is developing signs arrhythmias. So they can send them, they can contact the patients. So that helps in providing the personalized treatment. It helps in managing these patients. So through the real-time monitoring, we can detect the deterioration of the health condition well in time. So that helps in to to do the intervention in a timely fashion, so that the things don't escalate. And we can also monitor the patient's adherence to the medication, because this is one of the most it's challenging aspects of the patient with a chronic condition. They are not compliant to their medications. So with the help of the AI driven predictive analytics, we can monitor the adherence to the medications as well. And similarly, so it automates the administrative aspect, like scheduling the patient for the appointments. So patient is at home. So these AI predictive models, they will analyze, yes, what is the patient preference, what is the time available for the physician. So they will give them appointments. So it's automatic. Now, moving on to the risk stratifications and the management. So it helps in identifying the risk. The patient has risk of developing some disease. For example, if the patient presents in the emergency department with severe abdominal pain, and patient has been diagnosed with pancreatitis. In acute pancreatitis, it's very important to identify the acute severe pancreatitis, because the mortality for the acute severe pancreatitis is around 25%. And we need to recognize them early, so that we can manage them in the ICU to prevent this mortality. So apps like Easy App, which has been validated on more than 5,000 patients worldwide, it has been shown to predict the acute severe pancreatitis with a very high accuracy. Similarly, in the surgery, so as one of the participants, they were also mentioning the role in the postoperative period, but not only the postoperative period, during the preoperative period, once you have the patient in the OPD, so now you can predict the risk of the complication. For example, the patient is the risk of developing some anastomotic leak, uh, patient risk of developing surgical site infection, hematoma formation, bleeding, in-hospital mortality before the surgery. And then it also helps in the planning of the surgery. In the intraoperative, provides real-time guidance during the surgery. For example, during the laparoscopic cholecystectomy, it helps the surgeons where the safe plane to start your dissection. And it also provides, you can create a 3D model of the liver for the complex liver surgery. So before the surgery, you can visualize where are the critical structures. And intraoperatively, you can visualize it. You can, with the help of the uh, augmented reality. So it gives you a very clear picture. The surgery becomes easier and reduces the complication rate. And during the surgery, you can also predict the amount of the blood loss, the estimated operation time, and then you can also predict the postoperative complications. So as I have already mentioned that it helps in the predicting the complication like the surgical site infection, anastomotic leak. It can analyze the patient deterioration. So it also enhances the patient care through provision of the proactive, that is, we are not waiting for the symptoms to appear. So it will detect the risk of developing some conditions and then provide a personalized means the recommendation will be specific to the patient based upon patient's comorbidities and the other factors. So it enhances the treatment. These predictive analytics helps in identifying the emerging health trends and the potential disease outbreaks. So we can predict, yes, through these Internet of Medical Things. So they are actually the analytics. They are analyzing the vast amount of the data continuously through the use of the patient's use of social media and use of smartphones. You're analyzing the data, and they can predict the potential outbreaks as well. So as again, so one of the participants was also mentioned that it helps in the triage as well. So once you have a patient in the emergency department, so actually these AI, they analyze the vital signs of the patient in real time, and then based upon the risk, they will triage them. So that will help in the resource allocation in the emergency room. And similarly, it also helps the administrator to allocate the resources by forecasting the variation in the patient flow. So that helps in the better management of the departments. You can allocate the resources department wise. So the AI predictive analytics also helps in identify the drug candidates. It takes around 15 years from once they have put up the proposal for the drug. It goes to the preclinical trial, then clinical trial, then it comes to the end user, the patients. It takes around 15 years. But the AI can reduce this time period, and we can have, it can also predict the clinical outcomes, the response of the patients to these drugs. So far, we have covered this AI in diagnostic, predictive analytics, and let's move to its role in clinical research and the medical education. So the AI is starting from the writing of the research proposals. It is helping in the selection of the participants in the clinical trials, and it helps in analyzing the vast amount of the data, and it can predict the patient's outcomes, the response to the drug, and it also helps in writing the manuscript and the publication process as well. Now, how the AI is reshaping medical educations. A quick activity time. And meanwhile, yes, analyzing the data make research process easier. Rephrasing, I think they have responded like the role of AI in the research. Yes, the AI is helping in writing the manuscript and making the research process easier, right? Okay. The renowned medical school like the Harvard medical schools, Stanford, the University of Southern California, they're already integrating the AI into their curriculum. The AI is being used to design the assessment and the evaluations. The traditional teaching method, they have their persistent problems. It's very difficult to engage the students to the traditional lectures. And because of the variations in the experiences which the students they receive, there's a difference in the training outcomes. And moreover, as you know, the medical knowledge is expanding day by day. It's very difficult for the students to keep up with the pace. So we need a, a platform which provides actually adaptive learning systems. So these intelligent systems, they actually adapt to the need of the students. So they assess their strength and the weaknesses, and they recommend the further study materials. And then they have the intelligent tutoring system. They are available, which provides a real-time feedback to the students and provide the personalized recommendation to the student for further reading. Similarly, simulation-based training and augmented reality actually provides this scenario, which is a realistic scenario that allow the student to practice the anatomy explorations, the clinical skills like communication skills, procedural skills, emergency management, and the decision making in a risk-free, immersive environment. Similarly, the chatbots, virtual systems, they are available 24/7 to provide the instant answers to the student questions, and they offer the explanations in case of the difficult medical concepts. So let's move to this is the last segment. After this, we will have a question and answer sessions. So in your opinion, what is the most important barrier to the successfully implementing AI in healthcare? Most important barrier. Now, please select the most relevant response. let's see. The personal bias and the cultural difference, that's great. And then the not accepted AI as reality. Okay, the training, and let me check the all of the responses. Okay, and let me check the chat box as well. Is there any response related to this? Integration with our environment, data customized to our setup. Okay, inexperienced staff. Okay, that's wonderful. That's great. Okay, so you're right. The bias in the training, the data for the AI, and the inexperience as well. So let's discuss the what are the key barriers uh, in implementing the AI in healthcare. So the first question that should come in your mind whenever the clinician they are asked to use the AI. So as a clinician, we ask ourselves, is it trustworthy? Can we rely on it? So how accurate it is? So just look at this image. Now, here the prompt was traditional African healer is helping poor and sick white children. And yet see the response, white healer and black children. And this is because of the bias in the training data. So this has the problems because this bias is not just a problem in the data. It is a social problem. So in order to resolve the problem, so we need to have diverse perspective while designing these AI models. So we need to involve the patients, the healthcare provider from different backgrounds, so that we can reduce this bias. So this is one of the uh, most important things. Uh, and the other thing is these AI models should be explainable. It should not act like a black box phenomenon. So so they should, for example, they are giving you a recommendation. They are suggesting your diagnosis, are providing your recommendations or the treatment option. So it should also explain why, how did it reach to the conclusion. So unless it provides you the explanations, how can I trust this AI model? This is again, it's the big challenge. Although no, the different their algorithm they are being used that helps in the explaining this their predictions and the conclusions. So so there are different frameworks. So whenever you're going to, for example, implement the AI into the in the healthcare, so so we should ask the AI company to provide us the training data. How do you train your AI models? So that it is actually representing your patient population. It's not like that this AI model was developed in some other country, and they they it was not representing your patient population, and obviously it will give you the false research. It will not give you the accurate research, which is you know that can even harm the patient as well. Now, just look at the picture. So the AI mistakes, they can be hard to predict. And, if it comes to healthcare, it can lead to the serious harm for the patient as well. This was a simple prompt. It's a simple, a prompt for the AI to generate these images. But if there is, if you are, if the AI commit mistakes related to the patient diagnosis, so the patient can have serious consequences. These are AI hallucinations. This is the big problem. Although there are different platforms which are actually flagging these AI hallucinations. So they will flag, yeah, this is the response, is probably hallucinations. So that send you the alert to the healthcare provider so that he or she can review it. Similarly, for example, the AI model make the mistakes. Who takes the responsibility? So is it the AI itself? Are the developers who had designed this AI? Are the healthcare provider who was using this AI? Are the healthcare institution who will be held accountable? So this also needs to be addressed with the help of the regulatory measures. Data privacy and the security is one of the biggest challenges. In order to train these AI models, we need a extensive amount of the training data. And once you are actually using these AI models, again, through these wearable devices and the Internet of Medical Things, you are actually gaining access to the patient's data. And how are you making sure, yes, you are protecting their confidentiality during the training and while using these AI models. So there are different frameworks the which the AI company, they need to follow these standards in order to protect the patient data and the security. So far, we have covered all these areas. So here is this visual actually summarizing my discussion, the points which we have covered in the sessions. So it helps in the early diagnosis through the imaging and interpreting the lab results. It helps the patients in the triage in the ER. It helps in scheduling the patient appointments. When it's integrated into electronic health record, uh, it liberates you in writing those notes. It listens to your conversation with the patients, and it will automatically transcribe your notes, and you will find them in your electronic health record. It helps in the drug discovery and development. It helps in improving the remote patient care through the real-time monitoring of the patient through Internet of Medical Thing devices. That's similar to disease outbreak predictions, the planning of the surgical procedure, intraoperative guidance, and provides the personalized recommendations. And most importantly, it predicts the diseases before the onset of the symptoms, especially in the cancers, cardiovascular diseases, and it predicts the patient's outcome, their complications, and they also stratify their risk as well. So actually, this is the video. Maybe it's uh, let me after the completion of the session, I will try to play it. Now, a simple question: will AI replace doctors? A, a quick question: yes or no? Very simple question. Okay, no, yes. So AI is not going to replace the doctor, but there's one thing sure. So those who don't learn the AI, they risk being replaced by the AI, right? It's not about the replacement. It is about collaborations. So in the future, uh, the humans, the doctors, they will collaborate with the AI. In that collaborations, so the human expertise like empathy, uh, the clinical judgment, it will remain irreplaceable. But the AI will handle the vast amount of the data, will analyze the data and provide the data-driven insights, and it will automate the process. It will take over those repetitive tasks. So, so if we want to make sure that we are not going to replaced by the AI, so it's very important to learn AI and the integrated engage with the AI today so that we ensure that tomorrow we are not replaced by the technology, but we lead it and guide it and develop the AI as a trusted partner. So I end my talk with John Maxwell famous quote: change is inevitable, growth is optional. Now, reflect, take a moment to reflect on what you have learned during the sessions and what is the one key question that remains uppermost in your mind about the AI in healthcare. This is actually question answer sessions. select the most important questions to be answered first. Let me go to the chat as well. How can we use the AI as a journal surgeon? Okay. Healthcare. Yes, Arya Jan, ride the wave AI in healthcare so you would not get left behind. Wonderful. From where should we learn AI in healthcare? How can we be skilled in AI? From Bilal Ahmed. How can we, okay. AI has implication in the medical education in every aspect. I will get the lessons, the burden, okay. We need to learn more from where, okay. Diploma is getting started in AI. In Pakistan, it's how much time it will take to be implemented in hospitals. Yes. Okay. So is it independent or will be affected by the company? I don't understand what is it independent. Are you ready to engage in AI education as lifelong learning? What will be my role as OBS Gynae? Oh, okay, good. Okay, good. So in the OBS and Gynae, so AI being used, for example, in the predictive analytics, you can predict the risk of preterm birth, the preeclampsia, and similarly, reproductive health. The AI can also help in selecting the embryos, right? And it also helps in the interpretation of the ultrasound. So it actually automatically measures the different the head size and everything. It also helps in the postoperative period for detecting of the surgical site infection as well. So it has a promising potential in the gynae ops as well. So there was another question. Now you can also you can open your mic and you can contribute and ask the questions. And meanwhile, I am going to review what are other questions.
Yes, if
Okay,
anyone wants to ask a question, they can raise hand and I can enter them.
where would empathy fall in the AI era? Yes, now they're actually developing this AI models for the empathy, but this empathy is not going to be replaced by the AI. So this is the thing which the AI cannot handle it in a effective way. So that is why the humans, they are not going to be replaced by the AI. This is my perspective.
Thank you, Dr. Shaka. There are a lot of questions in the chat box for you.
Let
If
me go
you
through
allow
them.
me, I can read them for you.
Yeah, yeah. Okay.
Okay. In Pakistan, how much time it will take to be implemented in hospitals?
It's not far away. I was just reading a news and just going to the media. There was the doctors from the Lahore. They were visiting the China, and I believe, I don't know exactly, they were about to implement the AI in their healthcare in their hospitals, but it's not far away. Now the people, there's increased awareness. Recently there was the international conference. They were meeting the related to the technology, use of technology at the national level, in which the different AI companies, like for example the MedOps AI, they are actually collaborating with the Pakistan the healthcare departments to implement this AI. So I don't know. I don't want to name the institution, but they are in their process. They are negotiating with them, and they are going to implement this AI.
Yes, thank
So
you.
it's not
There's
far
another
away.
one question is asked multiple times that where to learn AI in healthcare, how to start and where to start.
Yeah. Um, Actually, I used to learn that YouTube is the best. It's a university, and you can go to you have there are different platforms, the Coursera, edX, they are also providing, offering the courses. But I have learned the AI through the YouTube, through the Google. So this is you are going through the different articles. This is how I have learned. But the different institutions which are providing offering the courses. Yes, Ara
We
ji.
have a raised hand.
Yes, yes, Ara, please. Yes, we would like
Yes,
to hear from you.
yes. Thank you so much, Dr.
Thank.
Ali, for letting me join this webinar. So, aside from all the advantages of AI that you have discussed, I just wanted to add, since this is in my line of work, we work with improving patient engagement through the help of AI. So, I work with Chris AI. It's under a bigger company based on Houston, USA. Chris AI is a chatbot platform designed specifically for and medical and dental practices. We focus on improving patient engagement, reducing staff workload, and helping clinics significantly boost their case acceptance rate through 24/7 automated conversations.
That's wonderful.
So, yes, thank you so much. So we are constantly evolving our futures. That's why I'm especially excited about this webinar. Understanding the clinician's perspective on AI integrations and all the AI advantages in healthcare is really valuable. And I believe medical professionals' insight could help guide our future updates on AI to make the platform even more effective and aligned with real world needs. What makes our chatbot special is that it keeps the patient's language while staying aligned with the clinic's voice. So yeah, that's it. I just want to add that AI also improves patient engagement, and it's not just the future; it's actually happening now.
Exactly, exactly. Thank you so much for your insight, sharing your insights. So let me ask you, what challenges you are facing while developing these AI models, especially related to
Oh,
the healthcare providers, the physicians, and the dental practitioners?
okay. So challenges usually is in building this chatbot, we face a lot of challenges in being careful with the data integration and being careful with patients' information. That's why we make sure that when we integrate, so our chatbot is integrated into the hospitals, the clinics website, and we make sure that during those integrations, we do not collect information from patients. What we do is answer all their inquiries. We help them through guided scheduling, and we educate them for what better uh, procedures they could help their case.
Okay, that's great. That's great. So it's very important. So data privacy is also very important while designing these AI models. So you need to be sure that you are actually protecting the patient's data.
Yes, that's something we prioritize in our company.
And how you make it a confident, how you anonymize it, because confidentiality is very important.
Come again, sir. What's
How do
the
you,
question again? Yes.
how do you make sure that the patients they are not while training the AI model, the patient, they are not being identified,
Oh, yes.
de-identification?
Okay. So since I said that this is a chatbot integrated into your website, this is one of the best features of our chatbot. It is very conversational. It is industry specific and company specific. So whatever the company or their specialization or the clinics, uh, that's what we put in our chatbots. That's how we train them. And since it is integrated in the website, once the uh, patient, a visitor of the website, open your website, it's automatically pop out and greet the patients. And If the patient have inquiries, you can ask the chatbot, but we do not collect their information. So all of their informations are secured.
Thank you. Thank you, Arif. If you have any other questions,
Yes, there's one question which has been repeatedly asked. Where do I begin using AI in my practice as a general surgeon? So, what is in there for general surgeons?
uh, right now, if you see it depends upon the healthcare, the hospital which you are where you are working. If it's not integrated into the electronic health records, so obviously there's no practical application in the journal at this moment. But it's not far away from being used in the general surgery. But as a journalist, what I can do is I can learn about the AI, how it's being used, what the AI is, how these models they are trained. This is most important thing, because before using the, for example, if you are asking the chat GPT, you should know how these models they have been trained, so that you can trust them, so that you will identify them. Yes, the these models, the this is what I think as a journalist we should be ready uh, to learn about the AI.
Okay, thank you so much. And one last question from the chat box that where did the question go? All right. Best roadmap to get AI basic skills in Saudi. How do you use AI in your practice? Right. So, who will be responsible if AI makes a mistake?
Yes, this is very good questions. So, the ultimate responsibility is the humans. So they need these whenever you're going to implement this AI, human oversight is always needed, and it will be needed, because, for example, for the accountability, you need to establish there is a relationship between the patients and the doctor. So if something goes wrong, so you cannot hold the responsible for the AI. Even the AI model, the company, they are not going to they are not going to be held responsible. Ultimate responsibility is with the healthcare provider who is actually using this AI. This is, again, it's very crucial questions, the dilemma which needs to be addressed with the help of the regulatory, with the regulations. So this is still, it's a gray area and very crucial. Till the time it's resolved, it's the healthcare provider who is using this AI. And one more thing, as a healthcare practitioner, how can we use them? We can use them, for example, in the medical education. We can use them as a teacher. Similarly, in the research, we can use this. These are low stake areas. But in the patient's care, yes, we can get the help from these AI models. For example, if you have a patient, so you give them a contact to this large language model, and it will give you the diagnosis, differential diagnosis. But most important thing is you need to cross check it. So go to ask them the justification for providing a specific answer. So then confirm confirm its recommendation. This is very important. But until unless it is integrated into the electronic health record, so there will be no practical applications. But the people, they are moving toward this the integration of the AI in their healthcare.
All right. So, I think that's it for now. There are no more new questions, but a few comments that in medical education we are using it, but it makes grave mistakes, which leads to unfair assessment. Yes, that has already been discussed. Uh, Dr. Shafaqat, thank you so much for a very informative, interactive session that has improved our take on AI in healthcare. The interaction by the participants has been great. I would request all of you to follow Mubahith on LinkedIn for more of such activities and more sessions from Dr. Shafaqat. I thank you all once again, and Dr. Shafaqat, thank you once again for being here and honoring us with your presence on this platform.
Thank you so much, Dr. Umar bin Abdulaziz, and I'm grateful to all of the participants. They have joined, they spared their time, and they joined in the session, and I also learned from their experiences. So thank you so much for sharing your insights. And before concluding the session, so please scan this QR code, so that I can respond to your questions. This is the feedback form. Please do provide me the feedback. And I have provided a space for the email. If I was unable to answer your questions, I will get back to you. Please scan this QR code and I will get back to you, inshallah. So this is all from my side. Thank you so much.